Hello, Lindsay Meyer here. We're going to be doing some wrist identification, range of motion, and manual muscle testing. So we're going to begin by identifying the styloid process of the radius. So you're going to find the radius down here, you go distally, and you're going to feel it pop right out in my fingers. Now to make sure that I'm not on the carpal, right there my thumb is, make sure I'm not on the carpal bones, what I want to do is I want to have the patient move their wrist over towards their side and back towards me. Good. So if I feel any movement on that bone right here, then I would know that I was actually on a carpal bone on the scaphoid and not on the styloid process of the radius. So we are on the scaphoid, the styloid process of the radius. Now from here, I'm going to have my patient lift up his thumb. Lift your thumb up. Good. Okay, now back down. Okay, so what I'm checking for is the extensor pollicis longus tendon right here. So lift up, it should pop right up into my fingers. Very good. So it's right here, it's the border of the anatomical snuff box, right there, in the medial aspect. Good, right there. Okay, perfect. Now from here, I'm going to do a few range of motion measurements. So we're going to do, first, we're going to do some wrist extension. Okay, so now I'm going to put your hand up here for me. Let's look at our camera. Okay, almost right there. All right, so what I want you to do, we're putting our patient in a nice neutral position, and what you're going to do is you're going to just let your hand fall back. Now, yeah, keep your fingers nice and relaxed, straight and then perfect. Okay, good. So we're just going to check and see what it looks like passively for the patient to move themselves. I'm sorry, actively move themselves. And now I'm going to move them passively and just check end range right there and feel the joint feels pretty good. Any pain with that?
No.
Okay, so now we're going to take a measurement, okay? So, in your hand right there, and now go back as far as you can comfortably. Good, fingers nice and relaxed. Good. All right, so we're going to line up our goniometer flat side, and we're going to take the other part right between his fingers just for comfort's sake. Okay, now we're here. Good. All right. Now what I would like you to do is see if you can move any further back. Good. Any pain with that?
No.
All right, so we're getting about 71 degrees, which is about what I expect for wrist extension. Okay, now relax for me. So now we're going to go back down onto the table. Okay, good. Right there. All right, and now we're going to take a measurement for radial deviation. So what I want you to do is right here, move your hand towards your pinky side. There you go, good. Any discomfort with that?
No.
Okay, so what we're gonna do is now we're gonna line up, now relax to the center. Good, now lift your hand up like this for me. Good, and back down. Okay, one more time, lift up. Good, so I'm just identifying where the capitate is, so I can use that for my axis. Okay. There you go. Right on my axis. Okay, okay. Good. All right, so now same thing. Hand over as far as you can. Good, I'm looking to line it up with the third metacarpal. Not following the fingers, actually find the metacarpal right there. Very good. Is that as far as you can go?
Yes.
Right about there. All right, and we're looking at about, here we go. All right, 16 degrees, and rest back down. Now, I would expect that to be anywhere from 0 to about 20 degrees, so 16 is within my normal expected range. Okay, so now, next we're going to do 2 strength assessments. We're going to do both wrist flexion and ulnar deviation. So the first thing I need you to do is, I'm going to just see if we can lift the camera up just a little. Okay, so we're going to have your hand, rest your elbow. I'm going to support you right here, okay? So what you're going to do is you're going to lift your fingers up and rest. Good, now relax your fingers. Do it with a relaxed finger. Good, good. I feel okay? Mm-hmm. Okay, so this is our wrist flexion. Looks good. He's able to do it against gravity, so we know we have a fair test. Now what I'm going to do is relax it. Relax. Okay, lift up. Hold it right about there for me, okay? Now I'm going to apply some pressure. You're going to hold. Do not let me move you, okay? Press your arm into me. Let me support you. Good. All right, you ready? Hold, hold, hold. Very good. Okay, now relax back down. All right, good measurement with that. And now we're going to have you actually stand up for our next measurement. Okay, there you go. Let me see if we can get this camera angle a little better here. Okay, beautiful. All right, so for this position, what I'm looking for first is to see if he can lift his hand up against gravity. Good. Any pain with that?
No.
Okay, so we know we've established a fair test, and now from here you're going to lift up again. I'm going to hold you right there. I'm going to push you. Do not let me move you, okay?
Sure.
Hold, hold, hold. Beautiful. All right, great. Okay, that's everything, and 5 out of 5 for both. No problems with any of the strength of the wrist. All right, thank you very much.